And so I think a lot of the work I'm doing now, I now do consulting with New Directions Collaborative, and we're really focused on how do we generate more leaders and create kind of facilitated events and trainings and ways to engage employees, because there are plenty of employees in each organization who have good ideas. So how do you really cultivate that in your people? And then also, how do we create networks so that many more colleges can follow Wachusett's lead? Or likewise, in the hospital sector with the clip we're about to see, there's all kinds of hospitals trying to go green. If they're caring for health, then the hospitals themselves shouldn't be creating extra pollution or using carcinogenic products in a cancer care center, right? So how do those hospitals do it themselves and learn from each other and, really kind of advance the whole field?
Great. Let's take a look.
The mission of Healthcare Without Harm and how it started was a number of nonprofits got together and decided to try to work on environmental sustainability, and they were looking at different sectors. And there was only one sector in this country that actually took an oath to do no harm, and that was the medical sector.
The first project that we did together was a mercury roundup, where we asked all of our employees, and we have about 6,000 employees, to bring in their mercury thermometers from home, and in exchange we gave them a digital thermometer. But the biggest part was educating them about why mercury was bad for the environment, both at work and at home.
And that then spread to all the other healthcare institutions in the city of Boston and spread across the country, and now as we're globalizing it, it's spreading across the world.
So the way we approached this was basically we started a grassroots effort here, and we got the buy-in from the staff, from everyday people, and said, each of us can make a difference.
My water mug that I fill every day.
And people on their own started doing things, everything from small things like using mugs every day. We got the cafeteria to buy into it.
Cheers!
3 major areas of our focus have been energy efficiency. We have automatic light turn-offs in rooms, and we have a program with our vending machines that they close down at night and go to sleep when there's no activity walking by. Then looking at our food service, and composting is something that we're doing now. And the third is shuttle service. By working with this communal organization, we sat down and developed a way to consolidate all the shuttles. I felt like I was a fish swimming upstream for a long time. I think the turning point came when our employees, including our decision makers, when their children started asking them, after they'd come home from school, Mom, Dad, what is your hospital doing to help the environment? And then all of a sudden I was getting phone calls and emails saying, Jane, tell me again what we're doing. I want to tell my kids, they're asking me questions.
We have a vision for healthcare 20 years from now to be a regenerative model where it can give back to the community. We see it as producing no waste.
And we believe from the hospital's perspective that the more we do these kinds of initiatives, the healthier people will be, and they'll have less need to come to the hospital. So we'd love to actually put ourselves out of business. We know that's not going to happen, but we really want to contribute to having a healthier world.
So one of the things that hit me sort of coming out of that clip is the shuttle systems and how the hospital connects to a wider community, both through its staffing as well as people coming to the hospital. You don't always have to come by ambulance, right? But certainly the staff, all of the many people, huge amount of people who work in a hospital. And that connection to the community that the hospital's really rooted in.
Yeah, and I think what's interesting with the shuttles too is just how in that case there was a number of huge hospitals located right near each other, and they were all running their own shuttle service for employees and other people. So it was all this duplication, back to the fact that things are fragmented. So by getting together and working out an agreement to have one shuttle, service everybody, it was a huge cost savings and reduction in fuel use. So that's a great example of how this alignment and connection around these issues can allow us to be much more efficient and get other benefits.
So in your work and in your life, what changes do you see out there that give you hope? I mean, sometimes in working in this field, we can look at it and say, man, we got a huge order of change that we need, and can we get there? But what changes do you see out there, or maybe that might be coming down the pike, that give you hope?
For me, it can be depressing kind of looking at the national or international level where you think we need some good policies and they're not coming down. However, I get inspired looking at the change on the ground, at the people like you saw in these videos who are making it happen and innovators who are putting a case study out there, and then the way we can network and connect to each other to make the change accelerate, scale it, replicate it very quickly. And the fact that with the internet now, we have this amazing ability globally to be connected. And a little case study like Wachusett, we can do a webinar and teach, 50 hospitals in Australia or colleges that same stuff. So I think the connectivity, as well as where this is marrying up with the entrepreneur spirit. And for example, in Massachusetts, the State Department of Transportation asked application developers to take the public transit data and make it more accessible to consumers. They made a little contest, and now they have applications like Where's My Bus? So on your phone you can know exactly when the next bus is coming by GPS. So making it much more convenient and enhancing ridership on an existing platform we're already investing in. So I think the sky's the limit on that now that everyone has computers and so many people can get involved in the solutions and share and spread what works. Of course, we still need good government policy and investment, to take barriers out of the way and let these good solutions work, but that's what gives me hope.
Great. Well, Beth Tener from New Directions Collaborative, thanks for coming in.
Thank you.